Last night, while you were sleeping, something was happening inside your feet that you almost certainly don't know about. Not pain, not an injury. Something quieter and far more dangerous than either of those things. And if you are over 60, there is a real possibility it has been happening for months, maybe longer, without producing a single symptom you would think to mention to a doctor. I need you to stay with me for the next few minutes, because what I am about to show you is something I have spent 20 years trying to get people to understand before it is too late. Not after the blood test, not after the diagnosis, before. Your body has already been sending you signals. They are on your feet right now. And once you know what you are looking at, you will never look at your feet the same way again. My name is Dr. Sandrine. I have spent 2 decades working with adults in the second half of their lives, and one of the most consistent and heartbreaking patterns I have witnessed is this. The patients who arrive in the most serious condition are almost never the ones who ignored their health. They are the ones who were paying attention to the wrong signals, waiting for a dramatic warning that never came, while the real warning was sitting quietly on the soles of their feet the entire time. Today, I am going to show you 9 of those warnings. Some will surprise you. One of them, the last one, almost nobody ever talks about, and yet it is visible to the naked eye and has been there for years in many people who have never once noticed it. We are going to go through all 9 together. But before we do, I want to tell you about a patient I will call Georges. 67 years old, retired engineer, fit man, genuinely. He walked every morning, watched what he ate, attended his annual checkup without fail. When he came to see me, it was not because anything dramatic had happened. It was because his wife had noticed something. His feet looked different at night. She could not explain exactly what, just different. When I sat with Georges and asked him carefully about his feet, something shifted in his expression. He mentioned that his feet had been tingling occasionally for about 8 months. He assumed it was the way he sat at his desk. He mentioned that the skin on his heels had been cracking badly, worse than usual, and that no amount of moisturizer seemed to help. He mentioned that one foot felt cold at night even when the rest of him was warm. He had an explanation for each of these things individually. He had never once considered that they might be telling the same story. His fasting blood glucose came back at 211. Georges had been diabetic for at least 2 years without knowing it, and every single sign had been on his feet the entire time. The reason this matters so urgently is a number I want you to hold in your mind. 1 in 5 people living with diabetes right now has no diagnosis. Not a delayed one, no diagnosis at all. They are going about their lives while elevated blood sugar quietly damages their nerves, their kidneys, their blood vessels, and their vision, in a process so gradual and so silent that the body never sends an alarm loud enough to recognize, except on the feet. The feet are the furthest point from the heart in the entire body. They are the end of the longest delivery route your circulation travels. And when blood sugar begins damaging the small blood vessels and the nerve fibers, the feet are where the evidence appears first, sometimes years before any other sign surfaces. So let us look at them together, beginning with the one that most people have already experienced and already explained away. That tingling. That pins and needles feeling, the foot falling asleep sensation, that arrives without a clear reason and returns more often than it used to. Most people file this under circulation, under sitting wrong, under aging. But when it happens regularly, without an obvious positional cause, what it reflects is something happening inside the nerve fibers themselves. Elevated blood sugar, sustained over time, damages the protective coating around the peripheral nerves, the fibers that carry signals between your brain and your feet. Think of those nerves as electrical cables. Every cable has insulation around it that keeps the signal clean and precise. When blood sugar remains elevated, that insulation begins to erode. The signals become inconsistent. They arrive as tingling, as numbness, as an intermittent fuzziness in the sensation of the foot. This is called peripheral neuropathy, and it affects close to half of all people with diabetes. It almost always begins in the feet. And it almost always begins years before the diagnosis. If tingling in your feet is something you experience regularly without explanation, That pattern deserves a conversation with your physician and a blood glucose measurement. Not eventually. Soon. The second sign is one that tends to arrive later in the day, when the house is quiet and there is nothing to distract from it. A burning sensation in the soles of the feet, often most intense at night when you are lying still. Patients describe it as heat coming from inside the foot, as though the sole is pressed against something warm when nothing is there. This is not a circulation problem in the conventional sense. It is a nerve problem. The same nerve fibers that have been eroded by elevated blood sugar begin to misfire. They send heat signals to the brain in the absence of any heat source, because the signaling mechanism itself has been damaged. The brain receives the message and interprets it literally. The result is burning that no external remedy resolves, because the source is not external. Research has found that this burning sensation is one of the earliest reported symptoms in patients later formally diagnosed with type 2 diabetes, often appearing 1 to 2 years before diagnosis. If your feet burn at night with a consistency and intensity that feels different from ordinary fatigue, that difference is worth investigating. The third sign is where the conversation shifts from discomfort to genuine danger. A small wound on the foot, a blister from a shoe, a minor cut, a cracked area on the heel that opens slightly, that simply does not heal. Normally, the body repairs small wounds within days. The process is precise and efficient. Blood flow carries oxygen, white blood cells, and repair proteins to the injury site. Tissue regenerates, the wound closes. When blood sugar is chronically elevated, the small blood vessels that deliver those repair resources narrow and stiffen. The delivery route is compromised. The wound receives what it needs too slowly and in insufficient quantity. It remains open. And an open wound on a foot with already compromised circulation and reduced sensation is one of the most serious medical situations an older adult can face, because the person may not feel the wound worsening, and the infection that enters through it can advance rapidly in tissue that cannot mount an adequate immune response. Diabetic foot complications are among the leading causes of non-traumatic limb amputation. Almost every case begins with a small wound that was not recognized for what it was. After your bath or shower this evening, sit down and examine both feet carefully. Between every toe, the heels, the sole, the top of the foot. Any wound that has not closed within 48 hours deserves prompt medical attention. Not next week. 48 hours. The fourth sign is visible on the skin, and most people have been looking at it for years without knowing what it means. A darkening or reddish discoloration around the ankles, sometimes with a bluish tinge, sometimes accompanied by skin that looks thinner or more fragile in that area. When the small blood vessels supplying the lower legs are damaged by elevated blood sugar, the tissue they supply receives less oxygenated blood. The skin changes color in response, reflecting the inadequate delivery of fresh circulation to that region. This is the skin communicating a circulatory problem that is occurring in the tissue beneath it. Research has found these skin changes are detectable on average 18 months before a formal diabetes diagnosis. If the skin around your ankles looks markedly different in color or texture from the skin further up your leg, and if that difference is relatively new, that observation is worth sharing with your physician. The fifth sign is one that most people attribute confidently to dry weather or aging skin. Cracked heels that persist regardless of season, that deepen despite regular moisturizing, that bleed in severe cases and simply refuse to resolve. The reason standard moisturizer cannot fix this particular problem is that the problem is not in the skin. It is in the nerves that control the skin. The autonomic nervous system governs countless automatic functions, including the regulation of sweat and moisture production in the skin of the feet. When these autonomic nerve fibers are damaged by chronically elevated blood sugar, the sweat glands in the feet stop receiving the signals that maintain skin moisture from within. The skin dries from the inside out. Topical application cannot compensate for a loss of internal regulation. The cracks that form are not cosmetic. They are entry points for bacteria in a foot with compromised circulation and reduced healing capacity. Moisturize your feet every night, thoroughly on the sole and heel, and never between the toes where trapped moisture invites fungal infection. But equally important, if your heels are cracking severely and persistently despite consistent care, Bring that specific observation to your doctor as a potential neurological signal. The sixth sign involves swelling. Not the mild ankle swelling that follows a long day on your feet, which is common and generally benign. Consistent, daily swelling of the feet and ankles that leaves deep indentations from socks each evening, and that does not fully resolve overnight. This pattern of swelling reflects a different mechanism entirely. The kidneys regulate the body's fluid balance with extraordinary precision. When blood sugar remains elevated over time, the kidneys' filtration structures sustain damage that reduces their ability to manage fluid excretion efficiently. Fluid accumulates in the lowest part of the body. Gravity does the rest. The swelling you see in the ankles may be the first visible sign that kidney function is being affected by blood sugar levels that have been too high for too long. Elevation of the feet above heart level during rest helps move accumulated fluid back toward the body's center. Reducing sodium intake reduces the fluid retention that compounds the swelling, and if this swelling is new, progressive, or accompanied by any other signs on this list, it warrants prompt medical evaluation. The seventh sign is the one most frequently misdiagnosed, particularly in older men. An intense, often sharp or electric pain in the foot, typically worse at night, that has been attributed to arthritis, an old injury, or general age-related joint wear. The pain is real, but its origin is not structural. When nerve fibers damaged by elevated blood sugar do not go quiet, they go hyperactive. They begin firing intense, random signals that the brain receives as severe pain, not because anything is pressing or tearing or inflaming the tissue, but because the nerve itself is malfunctioning and sending false alarms continuously. Taking anti-inflammatory pain medication for this kind of pain is the equivalent of silencing a fire alarm rather than finding the fire. The alarm is not the problem. The nerve damage generating it is. And masking that signal while the underlying cause continues to progress is not a solution. It is a delay with consequences. Gentle stretching of the foot and ankle before rising each morning and a light massage of the sole each evening support circulation and nerve tissue health in a way that no painkiller addresses. The eighth sign is one that many people accept as simply who they are: consistently cold feet, cold in warm weather, cold under multiple blankets, cold when the rest of the body feels comfortable. When the blood vessels supplying the feet have narrowed significantly due to sustained high blood sugar, the volume of warm blood reaching the feet becomes insufficient to maintain normal tissue temperature, regardless of the environmental conditions. The cold is not about the room. It is about the pipes delivering warmth to the extremity. A daily purposeful walk of 30 minutes, even built gradually from 10 minutes, drives circulation into the feet and lower legs and is one of the most effective interventions available for early peripheral vascular compromise. The ninth sign is the quietest, the most overlooked, and the one that I find changes something in my patients when I point it out, because they look down and realize it has been there for a long time without ever registering. Look at your lower legs and the tops of your feet. Look at the hair there, if there is any. In people with significantly compromised circulation from long-standing elevated blood sugar, the hair follicles on the lower legs and feet gradually stop receiving adequate blood supply. Without that supply, they stop producing hair. The absence can be gradual enough that it goes unnoticed for years. Hair follicles are among the most sensitive tissues to circulatory insufficiency. Their disappearance from the lower extremity is a visible marker of blood vessel damage that has been accumulating quietly across years. Look tonight. If the hair on your lower legs thins markedly below the knee or is absent from the tops of your feet, schedule a blood glucose test this week. A simple, inexpensive, widely available test. What you do with the result of that test, if it comes back elevated, is a conversation for you and your physician. But that conversation is one of the most important you can have, because caught early, elevated blood sugar is one of the most manageable chronic conditions in medicine. The tools available, dietary adjustment, daily movement, medication where needed, are effective when deployed early, and almost always insufficient when deployed late. Georges came back to see me 3 months after that first appointment. He had made changes, real, consistent, daily changes, and his blood glucose had responded. He told me that the tingling in his feet had lessened, that he was sleeping better because the nocturnal discomfort had reduced, that he felt, in his own words, like he had been given information he should have had years ago. That is the only thing I am offering you today. Information. Your feet have been speaking. Now you know the language. Listen to them tonight.